So the space is hot and the need is great. So what about the opportunity? Let me tell you about that. There's about three major converging forces you need to know about. One is, you've heard the statistic that there's 30 million Americans uninsured. That target market alone would have us all salivating. 30 million people not being served at all, and we can help. Second, over 40% of people are underinsured, part of a high deductible health plan market that's been growing in the system. When you're in a high deductible plan, you have to pay the first couple of $1,000s of fees before any insurance kicks in. We can help there too. Our solution puts money in your pocket, not the insurance company's pocket. A win-win that pays back handsomely. And another equal statistic, 40% of Americans have no primary care doctor at all. And that will get worse as the shortage of doctors grows over the next decade. People will be forced towards unacceptable solutions like going to the emergency room and clinics, wasting their time, their money, and importantly, not providing any integrated care for them. With these market factors at work, and they're at work right now, we're uniquely positioned to help you succeed right now. So let me tell you a little bit about us before we get into the presentation. Our history is quite unique. We began servicing doctors to practice better medicine. Our solution was designed for doctors by doctors. And because of that, we're very different than any competition, and we have greater measured effectiveness. We are really a healthcare solution, not a healthcare product. We stand apart in a few ways. Among them are, number one, we address the largest problem in medicine today, and that is people just are not educated on their own health. There's usually no one to trust in asking questions because everybody has a proprietary interest. Unless you have a doctor or nurse in the family, you're kind of stuck. Well, we solve that problem by providing you, and anyone you sell this to, reliable and trusted guidance from a registered nurse all day, every day, from anywhere. They work only for you. Their job is to provide you the most sound advice to get the most appropriate care at the appropriate time. When you do need care, we have the largest telemedicine service in the United States, with licensed physicians in every state. We're also the only firm providing an alternative medicine solution for people. And alternative medicine gets into mind, body, and spirit health, major factors today in how we're growing. Our members like to say that enhanced care is like having a doctor or nurse in the family. And the last point, with nearly 70% of families having a prescription drug in their budget, having a controlled healthcare solution without that would not be comprehensive enough. We are the only ones that have an exclusive deal with Walmart. That's not a discount card program. It's a savings plan you can count on. So together, we can influence better health in the market, and we will reduce costs. And oh yeah, one more thing. I think it's important for you to know. We've provided 5 links, an exclusive in the direct selling space. That's right. You will have a jump on any and all competition. So together, we're in the right place, it's the right time, and we have the right people with you and your downlines to sell this to millions of people waiting for a solution. So now let's learn a little bit more with our presentation. We have our marketing team ready to take you through the features and advantages. And of course, as Lee said, we'll be here for questions afterwards. So let's get to the first slide. And basically, I'll summarize that with my introduction as basically saying, Enhanced Care is a comprehensive solution that provides affordable health care all day, every day, from anywhere. We address more than 80% of people's everyday health care needs in one trusted place.
Well, thanks, Jerry. This is Dave Coffey, and now I have the next section to talk about the features of the program. But before I start going on to the features of the different pieces that you'll be able to access, I'm going to start with a few questions just for you to think about and just answer to yourself through the course of the presentation. Because these questions are for you, your downline, and your clients. So here's the first one. In the last year, how many of you, and maybe yourself or your family member, have actually gone to the doctor or to an urgent care or the emergency room in this last year because you were sick? Not because you had an injury, but because of sick issues and you didn't have access to those things. How many of you have actually purchased prescription drugs in the last year, and maybe even maintenance-related drugs that you have to take every day? And how many of you have actually thought about maybe you've actually gone online, Googled or Binged, whatever you want, a healthcare topic, and you just didn't feel satisfied at the end of the answer that you were trying to research, and you wish you had better access to information. All these questions, and if you answered yes to any of them, our 5 links Enhanced Care MD program can really help you. So we're excited to share the features of it. And let me give you the summary. Jerry did a really good job. It's really 4 pieces. You get access to a nurse 24/7, 365 days a year, and within 30 seconds you're going to be able to talk to that nurse. That nurse is going to be able to assist you on should you go to the doctor, should you not, is there a self-care option, what are your options, the most appropriate level of care. But if you do need a doctor and it's something that you want to, instead of going to an urgent care or to your current doctor because of convenience, you can go to one of our telemedicine doctors. You'll make a phone call and then guaranteed within 2 hours that doctor will call you back, but on average it takes about 35 minutes. And you can do this all from the convenience of your house, your office, or your car. So it makes it really convenient for you, eliminating a lot of stress and time. The other piece is, if you did need a prescription, those doctors are able to write you a prescription. And so we felt that, we want to start giving you an opportunity to really have true savings. There are a lot of programs out there, but when it comes right down to prescription savings, Walmart Sam's Club has the cheapest, lowest cost prescription drugs out on the market for the cash price. And this is the best part about it. Their low-cost price, if you compare to others, is the lowest mark. But our program gives you an even deeper discount. And on average, it's about 23%. We'll talk more details later. And we also know that alternative medicine solutions are becoming more prevalent in the market. And people are looking for alternative ways to address their issues in their health. And so we have a resource center that gives you access to practitioners, over 8,000 in the country. So let's go into more detail on each of the features. And I'm going to talk about the nurse. Because you know what? I've used that nurse so many times. If you have a family, if you don't even have a family, but you ever just want to know, hey, should I go to the doctors? Is this viral? Is this bacterial? Have you ever gone to the doctors and they said, oh, it's viral. You're going to have to go back and rest and drink water, right, Tina?
Yeah.
They're all shaking their heads.
Sure.
This all happened to us before, and it's frustrating because then you go and you sit and you just spent the money on it. Well, here's the thing. You call the nurse. Within 30 seconds, that nurse is going to be able to answer or at least help you decide what's the best course of action. And here's the thing. The nurses, their experience is over 15 years of experience. You can call them as many times you want in the course of the day, 50 times. You can call them about triage or issues of sick, but also about, hey, what if I wanted just to learn about a procedure that I'm about to go through? Or, I had a question about cancer because, I have this lump that I think might be something, and I really need some help. So the nurse is there for you, and we actually call the nurse our quarterback. We want you to start there because it's so easy, so simple. Within 30 seconds, you can be talking to a nurse and getting the right guidance.
Thanks, Dave. Hi, everyone. I'm Angie, and I'm going to tell you about our telemedicine portion of the Enhanced Care MD solution. You have the ability to make a phone call and have a consultation with the doctor over the phone. What have your choices been up till now? Well, if you're not feeling well, you pick up the phone and call your doctor. You hope that your doctor, first of all, you hope to get a live person on the phone. You hope that your doctor can schedule you in on your time. And more often than not, that does not happen. So you're finding yourself rearranging your life, rearranging your schedule so that you can get in to see your doctor and losing a chunk of the day that you didn't want to lose. Or how about the 40% of the population that doesn't have a primary care doctor? What do? They more often than not will go to an urgent care facility, spend hours, spend an entire evening to get taken care of, and it's not cheap. And a lot of us probably know people who use the ER to handle their everyday health care needs. So they'll go to the ER and sit in a crowded emergency room waiting to be treated for something that is an everyday health care need that our telemedicine doctors can handle. So you now have the ability to call on your time. Call late at night, at midnight. Call 5 o'clock in the morning if you need to. Call from your home. Call from your office. Christmas morning when somebody wakes up and doesn't feel well. The doctor is available for you. Make a phone call. You call and ask for a consultation. Guaranteed within 2 hours the doctor will call you back. Normally, average, within 30 minutes the doctor is going to call you back. So think about if you have a job that takes you on the road all the time. You don't have time to go see your doctor. You can make a phone call on the road. How about a young family? Packing up a bunch of kids to go sit in an urgent care facility is not always the best choice. A worker who can't leave the job, an hourly employee who loses wages if they have to leave the job. How about if you're on vacation? Who wants to lose a day of your vacation sitting in an urgent care facility? That happened to me, so I got experience with that one. You now have the opportunity to make a phone call and have 80% of your health care needs taken care of. It's affordable, anytime, anywhere. In fact, the AMA did a study that shows that 4 out of 5 of your doctor visits could actually have been handled with just a simple phone call. 4 out of 5 visits. A phone call could have treated that everyday health care needs that you had. And what are some of those? Let's say if you've got allergies, sinus infections, respiratory infections, colds, flus, migraines, you name it. There are so many things that can be treated by a phone call. Our doctors have the ability to write prescriptions. So if a prescription is needed, you send it to the pharmacy. You ask him to send it to the pharmacy of your choice. And what we've done is we've added the prescription savings plan through Walmart. This started out as a little piece of our program, but it has grown into a huge piece. And the reason for that is what we've learned is that prescription costs are absolutely not consistent from pharmacy to pharmacy. And true to Walmart form, the prescription prices there are lower than the other local pharmacies. And then what we have found is not only are they lower when you take our program, you get an additional discount. So for people who have a regular prescription that they're filling, or for someone who fills a very expensive prescription, you have the ability to really save a lot of money by using Walmart. On average, the savings you will see is usually between 15 to upwards of 60%. On average, you're going to have about a 23% savings. So it really can add up if you have a lot of prescriptions. Yes, on this page we're giving you just an example of some of the savings on the drugs that you can use. And it's a simple process. There's one form you take into Walmart, register yourself, and you're automatically on the program and you're going to start enjoying the savings.
Now we're going to talk a little bit about the health and wellness portal as well. Alternative medicine is the fastest growing part of healthcare. Many people have realized that your health is not just physical. It really is a balance between your mind, your body, and your spirit. In Enhanced Care, we are unique in providing this service. This is another benefit that no one can get elsewhere. We provide a mind-body-spirit portal that serves as a resource center for information about all different levels of alternative care, self-care and how to help you get yourself better, and then if you need resources, we have over 8,000 practitioners that we've credentialed to provide you discounts in both massage therapy, acupuncture, or naturopathy. What's good about this is if you use those services, or anyone you sell to uses those services, and their practitioner's not in our program, refer them to us, and we'll get them in the program. And what's in it for them is they then get exposure to our millions of users. They're going to build their business, and then they will end up, their only commitment to us is they've got to offer our members 20% discount on what they're doing. So they're going to grow their business, and then you get the benefit even if someone's not in your local area. So you could sell this even on top of what you're doing now.
So let's talk about the advantages. We talked about the features, and we gave you a lot of advantages too, but really think about this. Our 5 Links Enhanced Care MD program is about access and convenience. Think about that. Receiving trusted, reliable, healthcare-related recommendations and help to make sure that you're going to the right level of care instead of going to the doctor when you don't need to. Or actually, what if you didn't think you needed to go to the doctor and the nurse says, this is pretty serious. You probably need to go to the ER right now. So you want to have that access. And the great thing about this is access and convenience is in 30 seconds. And instead of going and driving to your doctor, and depending on where you are, if you're in a major metropolitan area, it might be easier to find an urgent care, an ER, or a doctor. But if you're in other rural markets, what happens? You're going to be traveling a distance. So this is going to make it even easier for you so you don't have to travel that hour or plus to go see the doctor or the local hospital. You could do it by just making a phone call to our nurse or to the doctor if you need that. And the great thing about it, it is really convenient. So many of our members, we've had, as Angie mentioned, members of ours have called from their sick bed. They're sitting there and they're making the phone call instead of getting up, packing up the kids and going to the urgent care or to their doctors. They're doing it from their home. We've had so many members call our doctors and nurses from work because they don't want to, they're so busy, they don't want to leave. And you know what? They said, I just need to get a prescription. I know I have a sinus infection. Geez, if I could just make a call and they could write the prescription. I don't have to leave work. I don't have to wait in the waiting room. I can get right there to my local pharmacy. And even better yet, if you want to make more savings, go to Walmart, Sam's Club. So it's a great program for access, convenience, and the quality of care because all these doctors are registered, licensed, board certified, 50 states. So if you're traveling, you're really providing yourself a lot of value. So let's talk about, we talk about value and savings, but let's talk about real savings. What is it really? You know, on average, first of all, our program can be for a single or a family unit. And so obviously for a family, you can have a lot more savings because you're impacting a lot more people. But let's look at it this way. We used savings are significant based on the average family size. And we're thinking anywhere between, with our data, it's anywhere between $1,300 to $1,600 per year you could save by using 5Link's EnhancedCareMD solution. Just think about it this way. Instead of going to the doctor, you call our nurse first. And did you realize this is statistically proven? 33% or a third of the time when you call our nurse, your expectation was to go to the doctor. And the nurse is able to provide you a self-remedy, a home remedy, that you don't have to go and go to the doctor. Pay the fee for that. If you have insurance, the copay. But if you didn't have it, you're paying anywhere from $150 to $200 for that doctor visit. Now, a third of the time, you can figure on not being able to have to pay that. So there's real savings there. But now if you did have to go see a doctor, as Angie mentioned, 4 out of 5 times that doctor visit doesn't have to be in person. You could do it over the phone, and the doctor will be able to save you time, but also money. Think about the cost that you're paying for that doctor each time. And let's say if you didn't go to your doctor, but you went to urgent care, or even worse, you had to go to the ER because you had no other option. Think about this. You now are saving the funds that you would have to pay for that, and that starts to impact you largely. And then on top of it, our Walmart savings program really does save. And on average, as what Jerry mentioned, there's, I think, what did you say, 70% of families have a prescription in the family that they're spending every year. So if you can find a way to reduce that, why not? Why pay more money on pharmaceuticals if it's the same drug? Why not get it for the least amount of money? So if you add that all up, you're looking at an average of anywhere from $750 to almost $1,000 every year on net savings. So we really know this program will work for you. So the first question always is, well, then who can benefit from this? Really, the honest answer is everybody. So everyone, insured, underinsured, and something that we're talking about is underinsured on the high deductible plan. And how we look at this is that our program can provide you easy access to affordable care options and services. So if you have a copay, many times our prescription drug program could even be lower than your average copay on your drugs. We've found that with many members. So you really should check it. And we don't know with every plan, it depends on the market that you're in, but generally speaking, you're going to find ways to reduce that. So it can benefit everybody. So let's talk about, here are some common things that we want you to really focus on the 5Link's EnhancedCareMD program. Angie mentioned before the American Medical Association, the AMA, did a study in 2012, but it's worth saying it again. 4 out of 5 times that you were going to the doctor, your doctor could actually have handled it over the phone, making it so much more easier, faster, and save you money instead of going to that doctor visit. We're not trying to eliminate your relationship with your doctor. We're just saying get it so that you're making it affordable for yourself. And now you have choices to make. Another piece on that, doctor, is this. What's the normal time that your doctor office is open? Well, on average, it's about 40 hours a week your doctor office is open, so you could go in and see them. Did you realize there's 128 other hours during that week there is no coverage? That's 76% of the time your doctor's not available. Well, with the 5 Links Enhanced Care MD program, now you can fill that time. When you need it, you can call the doctor. And don't forget, our nurses, they're available, ready to serve you within 30 seconds on average, and they'll be able to help you determine what's the best route for you regarding your health care.
So on to the pricing and compensation. So everyone is wondering how much this will cost you. Well, I'm really excited about the pricing. We have 2 plans. We have our single plan and our family plan. The single plan is only $24.95 a month, along with the family plan being $29.95 a month. Guys, this is a small price to pay when it means peace of mind for you and your family. There is also an MD telehealth doctor consultation fee. This fee is normally $38, but with your 5 Links Enhanced Care MD membership, you're only going to pay $5 every time you call the doctor. That's a savings of $33. I wish this was available for me 3 weeks ago. I have 3 kids. And 3 weeks ago, all 3 of my kids got sick. One gets it, they all get it. We all know how that goes. And I had to bring them to the doctor. Not only am I trying to make it so, my car doesn't get all disgusting and trying to get them in there, but, they're sick. They don't want to go anywhere. If I had this 3 weeks ago, I would have been able to call and save myself over $300. So it is definitely amazing. So we're looking at points, and yes, this will be awarded 1 customer point. Absolutely. So I'm sure we're all wondering how much will this pay out to the field be? Well, I decided that with all the work I put into this product, I should get $1 of the CV. Lee didn't find that so funny. So we went back to the drawing board and decided that for the single plan, we would pay out a $3 CV. And for the family plan, we would pay out a $4 CV, putting this product at the top of the residential CV payouts, which is fantastic. So with the pricing and compensation this way, I know that this product is going to explode out there in the market. So how to order? Ordering's easy. You're going to go to your virtual office, and there will be a link available after the meeting today. On the left-hand side, it says 5 Links Enhanced Care MD. You're going to click on that, and you're going to go right through the sign-up process. Make sure that while you're signing up, you do double-check the email address that you put in, because after you sign up, you will receive a welcome email. And this welcome email will have 3 important documents for you. It's going to have your member card, your Get Started packet that gives you all the details you need, and your Walmart prescription savings form.
So how to get started? Actually, it's very simple. We're all about ease and convenience. Once you join as a member, you do get an email, and in your email you have your member card, which will have your name and your ID, your member ID. You'll get the Walmart prescription savings form, and you'll also get a Get Started packet, which is really a how-to on how to use all of these services. So when you log in, initially you'll log into enhancedcaremd.com, put in your member ID number, and put in the default password, welcome, with a WL, the capital W. Then you'll be asked to change your password, read and accept our terms and conditions, and you are good to go. You're going to get to our homepage, which gives you 4 windows. Now, we recommend that when you take the nurse phone number, plug it into your cell phone. Take the doctor's phone number, plug it into your cell phone. You can't plan for when you're going to be sick, so if you have those in your cell phone already, you're going to be able to use it when you need it. So when you see these 4 windows, you can start using the nurse right away, immediately. The Mind, Body, Spirit Connection has got a wealth of information on spiritual, emotional, mental well-being. It's got great info. Use it. The Prescription Savings Plan is going to save you dollars. Use it. The MD consultation piece requires you to enroll. It's quick. It's simple. You have to create your own username and your own password, because you're going to have your private health portal in there. Personal to just you and your family, if you include family members. In it, you can track all your health information. You can keep a list of medications, allergies, and all your doctor consultations will be in there. So if you choose to share those doctor consultations with your own personal doctor, you can email that information to your doctor. You're also asked to fill out a personal health history. It's a fairly straightforward, mostly yes and no questions that you'll answer, so the doctor has some sense of who you are. Are you on medications? Do you have allergies? What, any chronic diseases? What is your family health history? Just so that when you have a consultation, he knows a little bit about you, and that's stored in your portal. This website also has an enormous amount of health topics for you to learn more and to educate yourself. We firmly believe that the more you know about your health, the better your health care is going to be. So use the tools that are in front of you.